So during the entire election campaign, I always said that the GHA was a fantastic institution with fantastic clinicians, fantastic nurses, but there's always room for improvement. So this is part of the calibrating the relationship between Ministry and GHA and working out how we make the GHA and the Ministry work closer in terms of policy, etc., so that we're all completely in step when it comes to making procedures more efficient, for example. Part of the consultation that we're launching today involves the GHA actually sitting with the Care Agency on the board. In the 6 months in this job, what I have seen is that there are a lot of procedures that start in hospital and end with the Care Agency, which outside you might not be aware that you're going from one institution to another. But to give you an example, if you're in the GHA and you're medically discharged and you're given a package of care, that package of care is provided by the Care Agency. But there needs to be more interaction between the Care Agency and the GHA so that it's a seamless procedure. There are numerous instances like this where actually the service is one where from the outside it's a complete service and you're not quite sure which institution is actually giving it to you. But actually it's GHA Care Agency, GHA ERS, so it would make sense to have everyone sitting on the same board so that the patient service is as efficient as possible and as seamless as possible. So that's a drive in this change.
As you mentioned, the Minister will now be chair of the board. The Chief Secretary would be the Vice Chair. In the manifesto just a few months ago, like you mentioned, it did say the GHA is now totally independent, the GHA is now depoliticised. We did hear just a few years ago there was a big move to take the ministry out of the GHA. So has that now changed? Is the GHA still depoliticised and independent?
Absolutely. So what we're doing is we're again recalibrating the relationship between the GHA and the ministry. In that recalibration, we're just working out the best way for the two organisations to work together. So, as I've explained in the press release today, we will be entering into an accountability agreement so that all clinical decisions will remain solely with the clinicians. All services will still be clinician-led. But there needs to be an interaction with the GHA and Ministry in relation to policy and setting policy and finance. And therefore, what we're trying to do is bring the two together in order to work more efficiently, whilst trying to always ensure that the clinical decision remains with the clinicians.
How will you ensure that separation whilst working so closely?
Well, first of all, I'm not moving back into the building. So the Ministry continues to stay in Europort in a separate office. And as I said, there will be an agreement which sets out exactly the remit of the Ministry's powers within the GHA. And in my head, I'm certainly very clear that we are involved in policy and finance decisions. Everything else remains with the clinicians, and the policy decisions, as we said many a time during the campaign, is clinician-led. There is certainly no way on the planet that I know more than a clinician who's dealing with patients day in, day out, what those patients need. They are the ones that need to tell us how to proceed.
Now, a major health reform was announced in 2021, the Reset, Restart, Recover programme. The government can't keep resetting the health service.
We're not resetting. So if you look at the health service, it's a continuously evolving animal. It's something which keeps on moving, which keeps on changing. Health provision keeps on changing. So this isn't a resetting so much as a progression. It's the next step. We need to look at what needs to be done, how we'd progress the health service, and how the example that I used in the press conference earlier this morning was that it's almost like clutch control. This is about trying to determine what the relationship is and what the best relationship is to always ensure the best outcome for patients. So it's a recalibrating of the relationship which started 3 years ago.
Let's talk about some of the other points in the press conference today. You mentioned the integration of mental health services. Will spending in this area go up? Usually the budget for the GHA is something like 120 to 140 million. And whilst that is a large amount, a very small amount is spent on mental health. Will this recalibrate spending and looking at that more closely?
So I'm actually quite excited to hopefully make a big announcement in terms of mental health during the month of May. And yes, the budget will be increasing this year, and mental health in particular will be given a particular focus, in terms of where the services are provided from, etc. So we're hoping to make a big announcement on that front in May.
With all due respect, Minister, we have had so many announcements about mental health, but the actual service seems to be demanded so frequently and not able to cater to people adequately at the moment.
I think it's fair to say that in the last 12 years, the mental health service has improved significantly. Are there, again, it's back to the mantra that I had during the election campaign, are there further improvements to be made? Yes, and always. The complement at the moment is currently back to being at full complement. And what we're looking to do is looking to change the way that the service works with the larger parts of it. So how do the psychiatrists and psychologists work with counsellors? What is the interaction between them and the fantastic charities that we also have in Gibraltar? We have Clubhouse, we have Gypsams. What is the interaction between all of them? So we're looking at the entire service working together. As you know, we've got a mental health strategy in place. And all of these things are about not staying still. It's about being consistently evolving to improve the service to the patient. So is there other things to do? Absolutely. Are we looking to do them? Yes.
You also highlighted the budget. 200 million was the figure, but that covers a number of things. So will this cost more to the taxpayer overall?
Will
this change?
So what we're actually trying to achieve is more efficiency. But as soon as you say the word efficiency, workers worry. So what we're trying to do is more efficiency without touching absolutely anyone's job. Yeah? So we are trying to provide the best possible service to the patient and look at how to provide that service more efficiently, but without costing any more. So I'm confident that there are ways that it can be done. So no, I don't think it'll cost the taxpayer more.
Okay, excellent. And just very briefly, in the on the contracts for the provision of services to the Care Agency and ERS, it says that those will be put out to tender through the Government Procurement Office as soon as possible. So does that mean to say that contracts were not put out to tender before in those areas?
Well, there was a debate in Parliament about precisely this question. We think that the contracts were put out to tender. In fact, we know that the contracts were put out to tender, but in order to avoid any possible doubt, the contracts were put out to tender in 2019 for the ERS services. So those contracts need to be retendered just to make sure that 5 years on we're still getting the best possible value for the taxpayer. What we are doing is that other services which haven't necessarily been contracted for in the past, such as services provided to the Care Agency, are tendered for and contracted for fully. And we're also looking to change the standards of training, of quality of care, etc., contained within all of those contracts. So when we put the contracts out to tender, they will have specifications contained in them as to exactly what we are expecting each care provider to provide us with.